You're not doing cheekbone implants.
Never.
A la Raffaini. I don't even know if Raffaini does that, by the way. He might not.
No, I mean, I could do them. They're easy to do, but they're never really warranted, because you can see here, for example, when this jaw is advanced, and especially if you cut high enough at the root of the zygoma, this, the eye is right here, right? The eye is right here. So this area resembles the cheekbone. So as this comes forward, it also has a widening effect. It makes the cheekbone stronger and wider just from that telescoping procedure you can see here. So if the advancement is enough, and usually it's going to be appropriate, right? If someone is deficient in the cheekbones, they're going to usually be deficient in the midface, so they're going to require a larger appropriate movement. But that movement, you can see here, will always enhance and widen the cheekbones. And if you look at the before and afters, I mean, make your opinion on that, what you think about.
They speak for themselves.
They speak for themselves, yeah.
So, but you showed me earlier in the week, because I kept pressing you on this.
Yep.
Can you hold up the skull if you would?
Yep.
And so essentially, as you do the Lefort and you advance the maxilla, right? And it's being held forward in that advanced position by the plate. And now you've created this little cliff area.
Yep. This step right here.
The step, correct. Better word for it. And then you stuff that with grafting material.
I put bone graft there, yeah.
And when that heals...
Yeah, it's no longer a real step. It's now a confluent...
A mound almost.
Mound, yeah. It's a confluent jaw that now has a 10 that's wider.
Right.
Yeah.
Right. Are cheekbone implants ever necessary post-jaw surgery?
I think for some people that have, strange, really rare craniofacial syndromes where they really malar deficient. But again, these are extremely rare. This is not what we're talking about.
Did you say malar deficient?
Yeah.
What does that mean? This
area we call the malar.
Okay.
Cheekbone. And, there's some craniofacial syndromes where they're really deficient, but these are extremely rare.
Genetic conditions, not just like wasn't breastfed.
Correct.
Ate something.
Correct.
This is
yeah,
a whole
these are
different
like
thing.
autosomal dominant craniofacial syndromes like Treacher's-Collins. And these are usually seen in a children's hospital and taken care of earlier with a team. They have cleft lips and palates. It's a different subset population. The majority of patients that are deficient from their jaws, and fixing them appropriately with jaw surgery will enhance the midface appropriately.
Right. Just for the record, I saw you do some genioplasties where you actually cut the tip of the chin off, plate it forward with custom plates. Is that how a cheekbone implant in a case like that would work? Are you actually slicing the cheekbone and then moving it? How does it work?
The implants are actually just veneers. They're basically either some kind of plastic or metal that are placed on it so that the tissue, kind of like a breast implant.
But not silicone?
Could be silicone. I don't think those are popular.
Yeah, some implants are better than others.
Yep.
Hard implants are better than softer implants.
I think if I were to do it, if someone really needs one, and I'm telling you the indication for it, I don't see, and I see 1,000 consults a year.
Right.
They're extremely rare. But if someone, when the time comes that I think someone will benefit from it, maybe a traumatic defect where they completely lost something.
Yeah.
I will make a titanium custom designed metal implant.
Oh, incredible.
Yeah, and you can make a very thin mesh, and I could put bone underneath it so that in the best case, the bone will actually conform to that, so the metal is not even needed with time. But even if the bone doesn't heal, the implant itself will provide the structure. I think that's, with technology now, I think that's the preferred way to implant. But we're talking about real traumatic defects, rare craniofacial syndromes that I think require these things. Otherwise, I think that the traditional custom jaw surgery is going to make people much better. And, look at the work itself.
Yeah.
And make up your mind. But in my experience, that's what I believe.
Yeah. While we're up in that area, I want to talk about bags under eyes.
Yeah.
something interesting happened this week where a patient came in and they said, "Oh, how will this affect my, the bags under my eyes?" Those have a name, right? You called it something. Is that a condition or something? I forget what it was, but you said basically that gets better with better sleep.
Yeah.
Is that your opinion? Is that not about bone deficiency? That's more about an endemic thing?
Could be a little bit of both, but we know, anyone that goes a day or two with bad sleep, they're going to have deep bags under their eyes. So there's no doubt that better sleep is better for that tissue over there. Mm-hmm. And then some people may have a structural problem too with the mid face where they just have lack support there. So I think it's a combination. When that mid face gets better with that Lefort surgery, plus they get better sleep, those almost always get better. You saw it with Eric right away. It's something you noticed.
True.
Yeah, but we'll see it all the time. And you look at the before and afters, people's eye, that structure, those eye bags get better.
Yeah.
After surgery. And I think it's a combination of the structural support plus better oxygenation, better sleep.
Also, while we're on the eye area, I'm not sure if you're familiar with Giant Implants, the channel, and
I am. He's an Instagram friend of mine.
Oh, nice. Yeah, me too. I've never spoken with them, him. I don't know who it is. It might be a group. Might be one mad scientist kid. I'm not sure. He could be a 17-year-old.
Right.
But he's doing this procedure. He's found some surgeon.
Yeah, I saw it somewhere in Turkey.
Somewhere in Turkey that's doing something to increase the interpupillary distance, modifying the orbitals, which are the bones around the eyes. Yep. What are your thoughts on that?
It's really interesting. I can appreciate the artistry behind it. I think that in most people don't need that type of enhancement. I think it'll make an artificial appearance, a comic book figure.
You think so?
Really, for most people. I think people with some craniofacial syndromes, again, that have real deformities or traumatic deformity, that's a great tool to help someone become more normal. But for someone that has deficient jaws and an otherwise normal head, that's non-syndromic, non-traumatic, I think that's not the prescription.
Right. It's a Looksmaxxing thing.
Right.
Giant Implants is not even sure he thinks in terms of airway.
I'm not sure. Yeah.
But while we're on that subject, what are your thoughts on Looksmaxxing and trying to build perfect faces from every theoretical cephalometric, angle, et cetera, the interpupillary distance? I think in general.
I think that people can be very attractive and good looking and look completely different. And, we know that. If you look at Hollywood actresses and actors over years, there are so many different styles of faces and pupil distance, and even asymmetries where someone we would all agree is attractive or not, and we all agree that they're all attractive or not, or to a great consensus. So I think that individuality and customization is really important. And I think for most people, health is attractive and aesthetic. So you make people a healthy version of themselves. And for a lot of these people that their jaws are deficient, and making their jaws to an appropriate place where now they have a jaw structure, a jawline, and for their face, that's the healthiest they should be. I think that they're going to be the best version of themselves and an appropriate, attractive aesthetic outcome for them. Mm-hmm. I don't think there's a cookie cutter. Everyone should look like Superman or Batman face. I think that Penelope Cruz is pretty, and I think that Julia Roberts is pretty, and Nicole Kidman was pretty, all in very different ways.
Yep. And Adam Driver is attractive, even though he's got a non-traditional face.
Yeah.
Or not textbook good-looking face.
Right.